Today we are covering genitourinary assessment, a topic the NCLEX loves to test through priority and action-based questions. Let's start with a common scenario. Your patient is 2 days post-op from abdominal surgery and has not voided in the last 6 hours. They are reporting lower abdominal pressure. The exam will ask for your priority nursing action. Many test takers get confused between urinary retention and oliguria. Oliguria is when the kidneys are not producing enough urine, typically defined as less than 30 milliliters per hour. Urinary retention is when the bladder is full, but the patient cannot empty it. In our scenario, the patient's symptoms point toward retention. Your first and best action is a non-invasive assessment, which is to use a bladder scanner. This tool provides an estimated bladder volume, confirming retention without the need for immediate catheterization. The exam wants to see you assess before you intervene. An incorrect answer would be to immediately insert a straight catheter. Another incorrect option might be to simply encourage fluid intake, which could worsen the distension if the patient is unable to void. Accurate measurement and interpretation of intake and output, or I&O, is another critical area. The NCLEX won't just ask you to add up the numbers. It will present a clinical picture and expect you to recognize an imbalance. For instance, a patient has a 24-hour fluid intake of 2,500 milliliters, but a urine output of only 600 milliliters. This discrepancy is a major red flag for either dehydration, where the body is conserving fluid, or acute kidney injury. The key number to memorize is 30 milliliters per hour. An output below this for more than 2 consecutive hours is a critical finding that must be reported. The exam will test your ability to connect low urine output with other signs, like hypotension or elevated creatinine, and expect you to act. When assessing the urine itself, use the simple mnemonic COCA, which stands for color, odor, clarity, and amount. Normal urine is pale yellow and clear with a mild odor. The NCLEX will give you cues in the question stem. If the urine is described as cloudy and foul-smelling, your immediate thought should be a urinary tract infection, or UTI. The priority action is not just to document. The best answer will involve advancing the assessment, such as obtaining a sterile urine specimen for culture and sensitivity before antibiotics are started. This brings us to catheter care and preventing catheter-associated UTIs, known as CAUTIs. This is a massive patient safety topic. The exam will test your knowledge of prevention strategies. A common question format is, which action by the nurse requires intervention? You must know that maintaining a closed, sterile drainage system is paramount. The drainage bag must always be kept below the level of the bladder to prevent backflow, but should never touch the floor. A classic exam trap involves obtaining a urine sample from an indwelling catheter. The incorrect action is to take the sample from the drainage bag, as this urine is not fresh and is considered contaminated. The correct procedure is to scrub the aspiration port on the catheter tubing with an antiseptic wipe and use a sterile syringe to withdraw the urine. Finally, when it comes to kidney function labs, remember that creatinine is the most reliable indicator. While BUN can be affected by hydration and diet, a rising creatinine level almost always points to worsening kidney function. If a question shows an elevated creatinine, you should immediately look for answers related to assessing for nephrotoxic medications, such as certain antibiotics or NSAIDs, and notifying the healthcare provider.